stone or a urinary tube stone, a kidney cancer, kidney transplant, bladder cancer.
Struggling with any such urology issues, Dr. Shreyas is one of your best options in India. He has extensive experience thanks to over 200 laser prostate surgeries and more than 150 renal transplants. Let's learn more about him in the next 4 minutes.
Hello, myself Dr. Shreyas Nagaraj. I am a consultant urologist, uro-oncologist and renal transplant surgeon. I basically completed my undergraduate, that is MBBS, from Bangalore Medical College, which is a 5 years degree. Then I went on to do my specialization in general surgery from Mysore Medical College. Then I super specialized in urology from Kerala Institute of Medical Science, Trivandrum. So this is what is my education background. I have been affiliated to the Urologist Society of India and to the Kerala Urology Society and to the South Zone Urology Association, and I have vast experience in urology, renal transplantation and reconstructive urology. See, medical tourism is a upcoming field. So what we see is most of the patients would have done a basic initial workup from their country. Like suppose if we stick to the stones aspects, a patient would have done a scan there. He would have noted that there is a kidney stone or a urinary tube stone, and he would have come here for a evaluation. So what we do is we further evaluate to know what exactly is the present status. Like we get a CT scan done to know where exactly is the stone, what is the size of stone, how do we manage the stone, and then we give a proper explanation to the patient. We have facilitators to make them understand in their own language as to what are the treatment that the patient will need. So basically most of the stones can be managed endoscopically. So we explain to them this is the type of procedure which will be performed and what is the recovery period. Usually for endoscopic procedure, if we do a surgery tomorrow, the next day itself he can be discharged. He will be able to travel back within a week to his country. So again, it depends upon the time frame, depends upon the condition which we treat. If it is a cancer, probably he'll need 2 to 3 weeks of stay in India, because if he needs any other further treatment like chemotherapy, hormonal therapy, which has to be initiated, and we also have to look up, do they have those facility in their country, so that we will be able to appropriately channelize these patients to their country so that they can follow up at those places. A few of the challenging cases where patient had multiple tumors at multiple sites. Patient had a same patient having a kidney cancer along with bladder cancer. So these are challenging cases because here the entire kidney has to be removed. Second thing, the bladder has to be removed, and we need to reconstruct the entire urinary system, and patient will be on a single kidney. So these are very challenging aspects. So we do all this complex surgery by laparoscopy. We have the advantage of 3D laparoscopy here, where the entire after removal of the kidney, the urinary bladder can be reconstructed. So these are few challenging cases when patient has multiple cancers, or one more case where the kidney transplant had to be done for a young boy because he had kidney issues from birth itself. So transplanting a kidney for a young, probably a 4-year-old boy. So these are few challenging cases which we quite often see.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.